If I could ask our panelists to come up. I don't know about you guys, but that was a pretty intense ride through 3 presentations. Alison, while you're getting ready, I wrote down crop depression. I think I know what it is. In my world, it's a brief crying spell in the doctor's office. But what a crop depression is just a low-lying area in the field? Is that
right? Yeah.
Okay.
And the reason why I showed that is because in a crop depression, not only you have direct irrigation, but you'll have runoff from the summit areas.
Okay. Just, I love that term. And if you guys could use your microphones when you ask you these questions. So I'm going to start teeing them up here. Remind you, ask your questions and bring them up here, and Sarah will help. This is to, I suppose, both Caroline and to Leo. Are there any current discussions or collaborations among government agencies to tackle, quotes, generally recognized as safe issues in human health or environmental health? So anybody can speak to this. Leo, do you want to start?
Thank you. We're in an interesting phase of transition because they've just named a new, or at least acting Food and Drug Administration commissioner who himself is a cancer scientist and director of the National Cancer Institute. So that bodes well for science continuing to stay and human health stay on the agenda. I would anticipate the most substantial pressure coming from the legislative branch. However, there has been a lot of momentum and discussion, quite frankly, about fixes to the Federal Food, Drug, and Cosmetic Act, mostly from the perspective of cosmetics, but that is a reassuring signal that will reverberate, because the same issues with toxicology really spill over both aspects. At the same time, I have some concerns about the Food and Drug Administration's own scientific approach. In particular, there's science suggesting that the dose doesn't make the proverbial poison here, and that low-level exposures are particularly impactful. And especially with bisphenol A, the FDA has not always taken the side of the strongest science here. So there are some areas for growth, and I see, as I described in my presentation, opportunities for both consumer attention to this issue as well as government from a variety of different angles that will get us where we need to be.
Okay. Carolyn, let me just ask you this, and again, Leo and also Alison, you'd like to comment. Is there awareness or discussion among nutritionists or physicians on the downstream effects of endocrine disruptors and antibiotics on the environment? How is that penetrating to date into the dietitian nutritionist world and the interface with the physician community or the pediatric toxicology community, to be more specific?
Yeah, I think, Leo, you might have something different to say for this. I think it's symposiums like this is raising our awareness. There is not a lot of discussion downstream. We're aware of it, and we're conscious of it and continuing to watch the science, but we can do a better job.
I'll just add that meetings like this are opportunities for different disciplines to crosstalk, if you will, insofar as there can eventually be scientific presentations at Dietetic Association or other scientific conferences that often you'd be surprised how that can move the needle here. So I'm not trying to commission myself. I'd commission other colleagues, but certainly that's an option there.
Okay. I guess to Carolyn, or perhaps to our pediatrician too, can you speak to recommendations regarding milk, animal-based versus milk alternatives?
Sure, I think so. That's a really good question, and I'll approach it from the nutrition side. That we still are recommending dairy as a great source of protein and calcium and vitamin D. If you choose to consume a non-dairy milk alternative like soy milk or almond milk or hemp milk, you really want to be aware that you're replacing, you want to find protein, you want to find the calcium, the vitamin D, and understand why you're doing it. If you have a milk allergy, if you have a lactose intolerance, these are great options. But I'm not saying you need to give up milk, and I think the dairy folks will appreciate that.
I would simply endorse and appreciate that. There are limited studies to weigh in about the degree to which you're trading out chemical contamination across those various sources. So the jury's still out in that regard. So in the meantime, I support drinking organic milk, but that's more from the perspective of reducing downstream pesticide use and ultimate contamination in that regard.
I might put on my epidemiology hat a little. The studies are very questionable as to the health benefits of milk per se, specifically animal-based milk versus plant-based sourced proteins in some of the studies. And increasingly, the connection drink milk for strong bones is also actually, there may actually be an inverse relationship with some of that in the way that we metabolize some of that calcium. So further reading and study in your area is probably welcome to that. At any rate, let's go here. Do you see opportunities to educate educators and students about correlation between plastics, contaminants, additives, nutrition density, antibiotics, et cetera, to drive change in our current state of health, especially in low-income communities? That's a broad question. Alison, I might ask you to talk a little bit. This was an eye-opening presentation for me about we really are a closed system. It goes somewhere. And the only really good news story I think that I saw in your presentation is that Mother Nature, through hydrology, when it filters down, does get rid of some of that stuff in well water. But by and large, how do you make this type of awareness for not only health professionals, but students? I'll start with you.
Really, well, symposiums like this is a great opportunity for making health professionals aware of this, and really trying to stress, like, there's two ways you could be trying to minimize this. One is to use antibiotics more judiciously. And when you, like if you're a clinician and you have a parent coming to you with a child who doesn't have a bacterial infection and they're pushing for antibiotics, trying to educate them, even in that setting, that it's not judicious to give those antibiotics if they don't have a bacterial infection. I've been in offices where they actually do have a little printout where they tell you like when you should have an antibiotic or not, which I think is a great step forward. Just letting the general public know. So I like to do outreach. So I'll go into classrooms and try to educate students not only about soil, but also about antibiotics and antibiotic resistance at a low level, to try and just get them thinking about it. Because a lot of times when you want to see change, kids can be more effective if they're going home and talking about this with their parents, and then the parents, it kind of opens their eyes, like, because I know I'm a parent and you kind of get in your own little bubble just trying to make it through. But when your kids come to you and want to do something different, you're more likely to do it. And so I think really making awareness of using antibiotics in a better, using them when they're appropriate. But also with the system that I work with, people are concerned about reusing wastewater from the standpoint of contamination. Well, if the soil is doing an adequate job of remediating it, especially for the groundwater system, we may not be as concerned about that. However, the plant uptake is definitely something.
Yep. It goes somewhere. A reminder that Dr. Neil Clancy is going to be here from Pitt talking about antibiotic resistance here in the next panel, I believe. Carolyn, do you trust that salad mixes are sufficiently pre-washed to eat directly out of the package? I love these grounding questions. I got to go to the store this afternoon, right?
So my mom's in the audience, and I feel like she may have asked this. So I think err on the side of caution. I will be completely honest. I am a mom. I am busy. There are times things that say triple washed, I believe it. But
it's going to get a fourth, huh?
Yes. Yeah. Yeah.
This, Alison, back to you. I'm skipping over here. Can you send soil samples to analyze for antibiotic contamination? And I'll put my And what do you do with the result even if you got it? That wasn't in here, but I had to add that. But you go right ahead.
Yeah. So there are some laboratories that you can send soil samples to and have them analyzed. It's pretty expensive, though. I think it's like anywhere like probably about $200 a sample. That's why I do most of my work in-house. Like the quantifying the antibiotics, I actually did that myself because it was more cost effective to do it that way. The other thing is when you do extractions like that, you're not necessarily just figuring out what's in the water phase. So that's something I didn't even get into though. Just because the antibiotic compounds are in the soil and you can extract them, when you do those extractions, you use solvents to really pull everything off that you can. These people aren't, especially these labs, they're not doing like water extractions, which would be more what you would want to know if you were concerned about interacting with the antibiotics being available for interaction with you or plants. And so a lot of times when you see those high concentrations of antibiotics, a large portion of it is actually interacting so strongly with the soil profile that it's not necessarily a concern. And we did do a wheat uptake study at our site. We predominantly saw just one of the compounds going up into the plant and mostly the straw, and we saw very, very minimal concentrations going up into the wheat grain, which would actually be what would be consumed. The other thing to take into account is the plants that you'd be most concerned about eating would be the ones where you wouldn't actually be processing them. So like lettuces and things like that. If you're cooking something, especially at high heat, or it's being processed before you would get it, like with wheat, the potential for those compounds to still be there is very minimal.
I'm going to go right to Leo on this one. I'm trying to look for you guys just great questions. I want to get to as many as possible. So, is tap water use better than bottled water due to the plastics?
My suggestion is that there's no real benefit for plastic bottled water consumption, except if you're on an airplane or in remote settings in which you really need a microbiologically free source. The reality is that many companies are actually rebottling water from a freshwater, or even sometimes a municipal water supply in certain countries, and remarketing that as bottled water and healthy water, or with a variety of misleading health claims attached.
Carolyn or Alison, organic farming relies on manure. Is that a problem?
It quite possibly could be, based on what I showed you guys. And that's the thing is, the manure that they use, even if they're culling the animals that are receiving antibiotics or whatever medicines they might be giving them, the manure at the end of the day gets all put together in most situations. They're not separating that out. They're not thinking about it from that perspective. And so if they're putting manure at an organic farm that has these antibiotic concentrations, or there's also hormones that could be in there too, which obviously I didn't even get into, then there's a potential that if it's getting into the soil profile, depending on the type of plant it is, there could be uptake into it. But again, it depends on how you're using those crops after. If they're being processed, then there's less chance of it being an issue. But it is a concern. At the same time, the concentrations you're seeing in these plants, you're not looking at overt issues. But there could be long-term implications if you're constantly taking in low levels of different compounds.
I think the only thing I'd like to add is remember in the 20% of produce is what we're meeting. We're eating 23% of our vegetables and 25% of our fruit intake. So in this case, more is just eating fruits and vegetables is where we want to start. For some people, the organic conversation doesn't even come into play. I know that was the question, but just more fruits and vegetables is key sometimes.
And I want to foot stomp on Dr. Who's commentary that is sitting on my desk, Frank. In other words, to your point, Carolyn, exactly. Let's not garble the message. Perfection is so the enemy of the good in this space when we're eating 1.2, that's our number, 1.2 servings of fruits and vegetables in Western Pennsylvania, folks. It is poor. It's not fair. It's not good. It's not excellent. We are so far below what we need to do to stem that 12-year-old's obesity, that we need to get real. So foot stomp on your point, Carolyn. But to that point, a lot of language being thrown around. How healthy are, quotes, vegan foods like tofurkey, vegan sausage, or ribs, or cutlets, highly processed soy-based products and proteins? I mean, to the point of the food industry is very good, and people want certain words. So what's your reaction to those, Carolyn?
I think that's a great question. A lot of times people think vegan means healthier, and that's not the case. You can be a very unhealthy vegan, case in point. You really want to look at what you're eating, getting back to whole foods as much as possible, and reading the nutrition facts. Fewer ingredients, the better. There's some level of processing that is needed, but very good point that there's a lot of added sodium and things in the processing.
Leo, what policies can the American Academy of Pediatrics and the Dietetics Nutrition Society share with principles to reduce the exposure of, these substances, among our children? I think partially is answered before about these types of dialogues, but
Right.
Where do you see this going practically?
So at least the Academy's report on the issue documented the grave concern about the generally recognized as safe loophole that needs to be revisited. In addition, there's substantial evidence to suggest opportunities for FDA action even without regulation. That can be more proactive testing. You saw the data on the substantial gaping holes in our knowledge about reproductive toxicity in particular. And so there are opportunities within and outside, so through the executive branch as well as the legislative branch to fix this. And in the meantime, the Academy's message is that we need to be empowered to be the change we seek on our own, and regulation will ultimately catch up.
I think I'd like to amend what I said earlier too about the in practice, the nutritionists aren't necessarily thinking downstream, but at the policy level and at our academy level, we have an evidence analysis library continually reviewing this research. So we will also put out a position or a practice paper when it comes to that point.
I would just say that for some of our colleagues that are here from McGee Women's Hospital, where a lot of these issues come up in our nursing staff and in the bedside conversations. So there's a lot of what is prudent versus alarmist, and a clinical tone is kind of where we're at here. Two questions on what I believe to be a common misconception, and Frank, if you'd like to weigh in here too on this particular one. What about soy phytoestrogens and estrogen response, the whole business of soy, good or bad? I'll just let people comment on that, and if anybody wants to chime in, Dr. Hu, go ahead.
So I want to jump in with a comment that I get thrown my way a lot. Well, soy is an endocrine disruptor, and my response, and so if soy was around all this time, why aren't we seeing epidemic increases in Asian countries where soy consumption is higher? And my answer is simply, well, we've introduced synthetic chemicals that were not designed with the human body in mind, that are over and above those naturally derived molecules that were designed with the human body in mind. It's not to minimize the role of and the estrogenic activity of naturally derived soy products. That's just part of human biology. We eat organisms. Those organisms have endocrine systems just like we have endocrine systems. And so it's not a surprise that we actually have naturally derived estrogenic exposure that we experience as a result of being part of an ecosystem.
If I might ask, Frank, if you have any comments, epidemiologically, in the large cohort studies that have been done internationally on the issue of soybeans, processed soy, tofu, et cetera, what does the survey say?
Well, there have been a lot of studies on soy and isoflavones and the various health outcomes. I think the main type of outcomes have been looked at. One is breast cancer, incidence of breast cancer and breast cancer survival. Another major outcomes, of course, is cardiovascular disease. So most of the studies looking at breast cancer incidence and survival have been conducted in China, in Japan and in Korea, which is not surprising because soy consumption is very high in those countries. In general, those studies have shown that women consume high amount of soy tend to have lower incidence of breast cancer. And for breast cancer patients, if they continue to consume relatively high amount of soy, there is a significant benefit in terms of survival. So in Asian populations, at least for those who have been habitually consume high amount of soy during their lifetime, there is a significant benefit in terms of reducing risk of breast cancer. But this kind of data are not widely available in the U.S. population. As you can imagine, the consumption level is too low to have statistical power to look at the issue. This issue. The only exception is the study conducted in among the Seventh-day Adventists by researchers at Loma Linda University. What they found is that there is some benefit in terms of cardiovascular health. For cancer, looks like the data are not very conclusive, but at least there is no significant harm for women who consume high amount of soy. In terms of cardiovascular health, we do have statistical power to look at urinary levels of isoflavones and also look at soy consumption, even though the soy consumption levels are relatively low in our cohorts, but we have accumulated almost 3 decades of data on soy and soy products. What we have found is that higher levels of isoflavones in urine samples and also regular consumption of soy, I'm talking about 2 to 3 times per week, not 2 to 3 times per day, in general associated with a lower risk of type 2 diabetes and cardiovascular disease. So based on the data from large population studies conducted in Asian populations and also in the U.S., I don't think there is significant evidence for harm, even for those who consume soy on a regular basis. But I think this is the area I think we need more data, especially in the U.S. population. The 7 days Adventist study, following another very large cohort of the participants, and want to monitor whether there is increase or decreased risk of various cancers, not just breast cancer, but also prostate cancer among men.
I would just comment, these cohort studies, the health profession studies at Harvard, the Loma Linda Adventist study, these are national treasures because you can answer questions intelligently like this rather than one-off anecdotes of case series. I think we've had more than 7 hours of professional education on this panel alone. So thank the panelists very much. We have a 10-minute break and we reconvene at 11:30.